Hello and welcome to this new episode of Encounter. Our guest today is an innovator. He has pioneered innovative solutions and techniques in the field of eye surgery. He is Professor Dr. Amar Agarwal, who is also the chairman of Dr. Agarwal Eye Hospitals, which have 200 more hospitals across India and Africa. So, Dr. Agarwal, thank you for being with us here on our set of Encounter. So we are going to talk about your innovative solutions you have brought in the field of eye surgery. But first of all, we would like to know briefly about Dr. Agarwal Eye Hospital.
Basically, Dr. Agarwal's group of eye hospitals was started by my parents, Dr. G. Agarwal and Dr. Mrs. T. Agarwal. And it started as one hospital in Chennai, India. That's Madras, the previous name. In 2006, we started expanding. And now we have about 270 hospitals across India and Africa. We are opening at present one hospital every week. So approximately we do 60 hospitals in a year. And by the year 2030, our target is to hit 500 or 600 hospitals. In 2010, we opened the first hospital in Africa, which was in this lovely place, Mauritius. Now we've got 3 centers in Mauritius, and totally in Africa, we have about 20 centers.
Okay.
That's the basic idea here, to eradicate blindness globally, to provide high-tech eye care at the doorstep. That is the endeavor of each and every person in the group.
So you yourself are an eye surgeon, and you have introduced quite innovative technology in this field. And when we talk about eye problems, the main problem is cataract, that we all know, we talk about that. So what are the new techniques that you have introduced personally in this field?
When you look at an eye, think of it like a camera.
Yes.
Now, in a camera, you have a lens, you focus it, the picture you catch onto the film, you send it to a studio to develop. Now, when we are looking, and as the TV viewers are watching me, the image is going through my lens into my film, which is the retina. And from the retina, it goes to the best studio in the world, the brain. And it automatically is developing. Just like how you're looking at me, and I'm looking at you, and the TV viewers of NBC are also watching. That's the way a normal eye works. Now imagine in cataract, it's like a camera's lens. If the lens is damaged with sand, you cannot use it. You take out the camera lens and fix a new lens. Same way in cataract, when it becomes white, and it's like an aging phenomenon, we take out the lens and fix another lens called an intraocular lens, or IOL. The problem comes if somebody has had an injury, a bomb blast, cracker injury, or complication in surgery, or patient has left the cataract behind and it has burst. I don't have support. Where to fix the lens? So we brought out a technology called the glued IOL, GLUED, glued IOL, where I'm fixing the lens with glue inside the eye. Now remember, we have synthetic glue like Fevicol, where I can stick 2 pieces of paper, but I can't use that in the eye. It's reactive. The glue I'm using is from blood, human blood. So it's absolutely safe. And this is called the glued IOL technology. Now on the 11th of December, that is on the 10th of December 2025, the Honorable President of Mauritius is inaugurating the Special Corneal Transplant Center and Pinhole Pupiloplasty Center in Mauritius. What is this about? Is this? In corneal transplantation, as I told you, we have a front window called the cornea. Now, if this gets damaged due to, let's say, a cut, or to a disease where the front window, instead of becoming spherical, becomes conical, we call it as keratoconus. Now, what happens in all these cases, there is a lot of aberrations. Now understand, we have like myopia minus,
Yes.
hyperopia is plus. Now another entity, refractive error, is called aberropia, in which the patient has high aberrations. We have to take somebody's dead cornea and transplant it in the living person. So when a person dies, the biggest sacrifice he can do is donate his eyes. And when a person dies, he gives 2 eyes.
Yeah.
So 2 patients can benefit rather than those eyes getting burnt or buried. So in this corneal transplant center, we are now going to have this surgery available in Mauritius, called the corneal transplant center, where we can take somebody's dead cornea and put it here. But Rishi, I tell you a bigger thing now is this latest technology called pinhole eye surgery or pinhole pupilloplasty. In the world, and I'm talking globally, 20 million to 60 million people are blind waiting for donor corneas every year. Obviously, you cannot get.
Yeah, that's huge.
It's huge number.
Yeah.
So what will happen is that backlog is going to increase. And this number is a rough estimate I'm giving you. Take Africa population is 1.5 billion. You cannot find out in India 1.5 billion, China 1.5 billion. In these 3 areas which I mentioned, you've got a 5 billion population. You cannot tell how many people are waiting for donor corneas.
Yeah.
So we brought out a technique called pinhole eye surgery. What is the principle? If someone has a cut or conical cornea like this, we are making the eye like a pinhole. Like these cameras, they have a diaphragm. Same way our eye, this brown structure which we see is a pupil or an iris.
Yes.
What I do is I make it about 1 to 1.5 millimeters. Let's say the scar is here, I will make it off center from the scar.
Expand.
The aberrations are cut off. The ray of light goes through the center 1 to 1.5 millimeter pupil, reaches the retina, from there to the studio, and the
Yes,
patient
right.
sees.
Yeah.
The best part is this, the patient sees distance and near without glasses.
So that's quite revolutionary, doctor. And we're talking about this kind of technology being brought here in Mauritius. And you're here, but do we have the proper personnel, the proper staff to operate that and do that here in Mauritius?
We do have it. And that is what the Honorable President of Mauritius, inaugurating on the 10th of December 2025, is the Pinhole Pupilloplasty Center. So what we have done is a very simple device. We have designed an instrument where we have got holes in it called 0.5 millimeter, 1.5.
Yeah.
We put it in front of the patient's eye, ask him, what size do you like? Let's say he says, I like 1.5. First of all, the patient has understood how the eye will look and how he will look with it. We will make on table a 1.5 millimeter pupil.
Okay.
Now, one more thing I tell you, if I do the surgery, let's say today morning, next day when I see the patient, he's bang all right. So these patients who are having transplant, they require medicines for about 5 years, 6 years or more.
Yes.
There can be rejection because after all, I'm taking a dead person's eye and placing it here, there can be a rejection. There are complications. I need an extremely gifted surgeon. I need instruments. Whereas in pinhole pupillasty, please understand the medicines are just put for 4 weeks. Just 1 drop 3 times a day. He sees distance and near without glasses. There is no rejection, nothing like that. But that does not mean all cases I can do pinhole.
Okay.
Some pieces will require transplant.
Yeah.
So depending on the indication,
Yeah.
but the amount of cases which are requiring transplant will reduce. So depending on what the patient wants,
Yeah.
the surgeon will decide or the doctor will decide which is suitable. And that's why this is the corneal transplant and pinhole pupillasty center.
Doctor, there's also, when we go for surgery, any surgery, there's the element of fear. So all those surgeries, are they done with anesthesia or without it?
They are all done with anesthesia, but there is no admission.
Okay.
The patient comes and he goes back immediately. Let's say the pinhole pupillasty would take the 20 minutes time. There is no pain at all. And after the surgery, the patient goes back.
Yeah.
So that is the beauty of this whole thing. our endeavor is what? Let's say in Mauritius, we are seeing that the Mauritian patients and even African patients coming to Mauritius can get treated in Mauritius and they don't have to go out. And today, pinhole pupiloplasty as an alternative to keratoplasty or transplant is happening in America. It's happening in Vietnam. It's happening in Russia. It's happening in other countries also. So as more and more people do this, we feel it will be a huge benefit to the blind waiting for donor corneas.
And we understand with this, the recovery time is less.
Immediate. Because, as I said, if I do the surgery in the morning and I see them by tomorrow morning, in 24 hours, there's a world of difference. Patients with keratoconus, we cannot imagine how blind they are. They are suffering. And they might be waiting for a donor cornea, which might not be able to get. And even if you get, there are complications after that.
Yes.
So let's say, theoretically example, I've done a pinhole pupiloplasty, and let's say the results are not that great. I can always do a transplant on top of that. Because there are patients with transplant, with clear corneas, they don't see. Because the aberopia or the aberrations are so much.
Yes.
So they require already a pinhole pupiloplasty. So that's the beauty of this surgery.
Doctor, we say that prevention is better than cure. We know in Mauritius, diabetes is a serious problem. And, you know, eye problems are closely linked to diabetes. And do people need to go for regular check, even if they are healthy, I mean, they see well? What do you advise?
You said a great sentence. Prevention is better than cure. The second lovely sentence you said, diabetes is a reality in Mauritius. But I tell you what, it is a reality around the world. All of us, including me, love sweets. And then we have so many festivals. So every festival, I find an excuse to eat sweets. Now, what it does is this. When diabetes affects the eye, you can imagine the blood vessel which carries blood in the eye, which is in the back of the eye, the retina. Imagine water going from here to here. So the blood is flowing point A to point B. The diabetes, what it does is, this blood vessel becomes weak.
Okay.
So the blood, instead of flowing from point A to point B, starts flowing out. In the beginning, it's a small leak. One day, the dam bursts. The whole eye gets filled with blood. Patient is totally blind.
Okay.
So very simple. What we have to do, when the patient comes to us, we give him an injection of a dye. The dye will move from point A to point B, and wherever it is leaking, it will come out. We capture it on a film. Then we use a laser and solder it. Tuck, 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 tuck.
Okay.
It's a soldering mechanism, and seal the leak. But let's say the patient has got a full bleed in the eye. What I have to do is I have to go in, we clear all the blood, and then do laser on spot on the patient. And please remember, what all I'm saying happens in Mauritius. So, what advantage is this? These patients can be treated. But let's come back to the first sentence you said, prevention is better than cure. So what I tell patients is this. If you are diabetic, please go to your eye doctor. Get examined by him. Go to your diabetologist. Get examined your sugar routinely. My suggestion is a diabetic patient should go to an eye doctor every 6 months. Because if you want to see the brain, the only portion of the brain we can see is the eye. Because an eye is actually a part of the brain. So the only portion of the brain, you can't see this brain here, but this you can see. And you can go into the eye and see how the retina is, which becomes part of the brain. So moral of the story is, please go to your eye doctor and get examined every 6 months so that you know you can catch this problem at an early stage. We talked about cataract.
Yes.
Please understand this, diabetes produces early cataract. So these are other problems which we have to control. If you control your diabetes, if you start eating healthy food from the beginning of your life, you know, when you're growing up, things will be better as you grow up so that you'll have a healthy life.
Yes. So, like you said, do things at a younger age. We know that some children are born with deficiencies in the eye, problems in the eye. Are there some solutions or some technologies to fix that for the children growing?
100% there are. You see, when a child is there, let's say a small example is the eye should be straight like this. Sometimes one muscle becomes weak or strong and one eye goes off like this. So one eye is seeing this side and one eye is seeing something else. The brain cannot take two images. It'll automatically cut off one eye. So what we had to do is, before the age of 5, we had to correct it, make it straight. How to do? Very simple. I told you one muscle is strong, one muscle is weak. So we make the weak muscle strong and the strong muscle weak and make the eye
balance
straight. Another very important thing is, you are a journalist, I'm a doctor, and people who are watching this also continuously are watching on the computer or TV. A problem comes called the computer vision syndrome. So as we are watching, please understand, water from this side of the eye goes out, comes to my nose and comes to my throat. This is natural. While we are standing and watching or sitting and watching, this is naturally happening to everybody. When we are watching a monitor non-stop like this, we don't blink. The amount of blinks which we do is less. So when you blink, the eye water from the left comes to the center.
Okay.
That reduces. When it reduces, there is dryness. That produces a computer vision syndrome, which will produce headache, eye strain. So what is this treatment? I'm not saying you can't do computers. I'm doing non-stop also. What I tell people is, work on the TV, work on your monitors, work on your tablets, work for 45, 50 minutes, take a break.
Okay. How much?
5 minutes.
Okay.
That's all I'm asking. And then come back. A simple trick, and that includes for you, Rishi, is keep your hands like this.
Yeah.
Close your eyes, and you can close it one like this and one like this. Put a pillow here. Cover your eyes. Think of what you believe in. 5 minutes. This is called palming. If you do that, just going for an interview, going for an exam, or even if you're taking an interview, non-stop pressure on you, watching the monitor because your deadlines are there, or in an examination, just take this technique called palming and you'll see life change.
Yes, that's very good. That's very good advice you've given us, Dr. Agarwal. Now, my last question will be, and you've introduced Agarwal Hospital. You have 3 hospitals here in Mauritius and super specialties, like you said. And who can benefit from it?
All the patients. My idea is this: Mauritius can become the mecca of healthcare and eye care. That is our endeavor. Today, if you see globally, the amount of blindness is huge. And with all these lifestyles not being that healthy, with diabetes, things like that will increase. And that's why I think more hospitals, more treatments will come, which will help each and every patient.
So for Mauritians and for foreigners also in Mauritius?
Anyone.
So Doctor, thank you very much for sharing all those experiences and knowledge that you have with our viewers. And we hope to see you again in Mauritius soon.
Thank you very much.
And well, viewers, thank you for watching. We'll meet again for another episode of Encounter. Goodbye.